Good morning. Our St. Louis County employees, specifically those in our Department of Public Health who've been on the front lines the past 18 months, have used a wide variety of different methods to communicate to the public during this pandemic. To be sure, convincing a county of 1 million residents to get vaccinated and take other actions they've never done before to protect themselves and the public at large is a daunting task. But we've been up to the challenge. St. Louis County has tapped into all of the communication tools at our disposal. That includes partnering with television, radio, newspapers, and other online outlets to provide information about the importance of vaccinations and how to access them. We've used the power of social media, and we've created partnerships with businesses, nonprofits, places of worship, and others as a part of our direct community outreach. It's through all of these efforts that we get people vaccinated and that our residents understand the importance of wearing a mask, avoiding crowds, and taking other actions to stay safe as we continue to battle a pandemic that is taxing our healthcare systems, has sickened tens of thousands, and taken the lives of 2,375 of our St. Louis County residents. Today, I've invited Spring Schmidt, Deputy Director of the Department of Public Health, to explain in more detail all of the communication strategies we are using to keep our residents as safe as possible during this once-in-a-century pandemic. Spring?
Good morning. So I'm here to talk today about some of the things that we've done to work on communications. We have had a lot of things to communicate. We've talked about data. We've talked about the mitigation strategies and the encouragement for testing. We've talked about masking. We've certainly talked about vaccinations and all of these opportunities. And given the size of our population, it does take a lot of different approaches. DPH started at the very beginning with our own staff, working on a wide variety of different products to communicate various messages to the public. Some of those that you should be able to see in terms of some social media pieces. We've created stickers and brochures and flyers and handouts that we've given out in community events, or that we've partnered with others to distribute in the community, or that we have handed out at neighborhood clinics and other types of events over the entire course of this pandemic, with a variety of different messages over time for whatever was the most relevant or important things that we needed to be communicating. We have also made sure that we have prioritized additional access for a variety of languages. We have partnered with other community partners to make sure that we were authentically creating opportunities for a wide variety of the diversity of our community to access this material in other languages and in other formats as often as possible. Many of these things have been developed in-house with the partnership of community members, where we tested and talked about what were the most relevant messages and opportunities to communicate. We have also used video at a wide variety of times. We published a variety of different Get the Facts videos. These have been fairly popular on both our YouTube streams and several of our social media pieces. We have utilized a wide variety of different influencers and community residents and political partners who have focused on giving these messages out to their communities. And these have been fairly popular, particularly in some of our social media spaces. And many people have resonated with some of those different community figures. We have really focused on creating a lot of variety of content in a lot of different accessible ways, because not everyone accesses information in the same way in our community. And so it's been really important that we have kept content as fresh as possible and continue to post out. So we do have a wide variety of social media platforms. We certainly have Twitter, Facebook, Instagram, things along those lines. So if you are not aware of that, please feel free to look us up so that you can also have accessibility to that information. The Get the Facts videos that we talked about in terms of those community influencers and stakeholders have been out on Facebook and seen about 25,000 views. We'd like to see that continue, so please feel free to share those as well. We have also had FAQ videos that we've put out that have helped answer questions from the community that we certainly receive all the time from our emails and from our hotlines and from many other opportunities where we are receiving feedback from the community, and we work to respond to those as well. Those have been seen over 208,000 times by community residents, so getting information and answers to questions out there has been a key figure for us for a while. So we have metrics that we do provide about what it is that we've been seeing. We'd still like to see those continue to grow. So if people don't know that we have those avenues available, where the health department is posting regular information and updates about what's happening in our community, what you can do to keep yourself and your family and your community as safe as possible, like please look us up on each of those. We have also used paid communication advertising. We have talked about this in the past in terms of, I think we gave initial presentations in some of our CARES oversight when we were originally planning to do this, but then as FEMA rolled out this year, we found out that it was a FEMA eligible expense and we did proceed in that fashion. So we have used paid advertising to reach additional markets to make sure that we were saturating as much of the communication as possible. We're about halfway through those campaigns at this time. So I'm hoping that some folks have seen some of this advertising that you may see here. There's a variety of print materials, billboard materials, documentary style videos, additional FAQ style videos. We're explaining different parts of the pandemic, as well as, of course, like social media and the opportunities to do that. We have currently had some of the digital advertising reach over 500,000 county residents and about 8 million or so distinct impressions and opportunities to be seen by county residents. So we do look at those metrics. And like I said, we're about halfway through this initiative at this time. About 84% of county residents who have visited our revivestl.com website have clicked on a video and watched it to its completion, which is a great metric to use for those kinds of videos because not everyone completes all of those videos. So that's been great. Some of the television, radio, and print advertising that we've seen have been seen more than 30 million impressions or opportunities to be seen by county residents and others in the metropolitan area because we know those media markets serve a larger group than just county residents. So the vaccination website, which we launched earlier this summer, has been seeing about 25,000 visitors. Our African American audiences have been 3 times more likely to navigate to the vaccination scheduling page than other types of users. It's really important that we look at these metrics because we are, of course, encouraging people to start vaccination uptake and make sure that they know where they can go, what kind of options are available, what is convenient to them. The revivestl.com website has the opportunity to select what geographic part of the county that you're in, and you can see our permanent clinics as well as some of our neighborhood pop-up clinics so that you can find something that is convenient to you in your area where you may want to initiate your vaccination process. We also, there are all of these other traditional forms of media and the things that we talk about in terms of mass media and digital strategies and things like that, but we have also been employing a lot of more grassroots efforts. So this is where we more talk about community engagement and where our staff, most likely, and some of our volunteers and partners are directly engaging in the community in some of our areas that we are seeing some of the lowest vaccination uptake. So our Beauty and Barbershop Initiative has been a great partnership in this realm where we have had our health promotion staff, as well as some of their other volunteers and workers visiting beauty and barbershops, talking with the proprietors, as well as some of their staff and some of the customers who are there. We have given out face masks and hand sanitizer. We've supplied posters and flyers as educational material, taken the opportunity to stop and answer questions. And at this point, even a couple of those business owners have partnered with us to host vaccination clinics that they have helped advertise to their staff in their community and their customers. So we really appreciate that because, again, this is where we are doing direct engagement with the population that we're the most significantly concerned about in this pandemic and making sure that we are there to answer questions, to provide appropriate information, and to offer access to opportunities to be vaccinated. We also work with other partners. Certainly the faith-based partnerships has been something that we have really valued in the health department before in a wide variety of topics, and that's certainly true here. We have partnered with a variety of churches throughout, particularly North County, but there are churches that are present from across the region. But we have worked with church leaders to also do the same type of education, provide literature and materials, talk about what questions or misinformation or myths some of their community members may have. We created a medical moments program where we have had videos of providers representing the diversity of our community, particularly our African American community, who have created short videos that they're calling medical moments and that have been played during church services and as part of church activities. So we're really proud of those because those have had a really good response so far. We have also attended meetings of faith leaders, conducted neighborhood clinics with a wide variety of churches at this point. There's been more than 35 clinics that we've done in partnership with community churches. 30 of those have been in North County. That's been a fantastic partnership that we continue to utilize as often as possible. So there's a wide variety of those meetings and those opportunities, and we meet with those leaders every other week to make sure that we're continuing to push the envelope. We do think that some of these opportunities are having results in that we are seeing the vaccine uptake for first doses happen faster in North County, particularly inner North County, than they've been happening across the entire rest of the county. I think it is a combination of all of these efforts. It's really difficult at this point to pick out which effort has the most impact, but because of the size and the volume and the complexity of our community, we have just worked to try as many strategies as possible to get the word out, not only about what's happening in the pandemic, what you can do to keep yourself safe, and the opportunities to access the vaccine. We will continue to do that. We are about halfway through those big communication mass media efforts, but we will keep up with grassroots community engagement efforts because it's just a core function of the health department, and those are the things that we will continue to focus on. So really, that's the primary update that we wanted to give about the variety of the stuff that we're doing in the health department. I think that there are many times where, given our overall low vaccination rate, we have one of the highest in Missouri, but it's not where we want it to be. So there is still a lot of need for us all to help communicate and lift the opportunities for vaccination, the need to continue to mask, the need to continue to test in order for us to continue to move through this pandemic as safely as possible. Thank you.
Thank you, Spring. We'd be glad to take any questions. Doug, do you have any questions?
We didn't have any submitted today. Does anyone have questions?
Okay, great. Thank you, everyone.